So this was a case of it's a younger horse that came in, I believe, that had a enlargement over the side of its face that was presumed to be a tooth root infection that had sprung up over the course of a few weeks. And the horse was very painful, kind of on the leading edge of the facial crest. And when I did the oral exam on this horse, the tooth looked entirely normal. Radiographically, the teeth looked decent, but we were still just trying to figure out on a dorsal ventral projection, I thought I could see something that looked enlarged along the facial crest. And so I was presuming that there was some type of facial fracture there. So we performed a CT on this horse, and I want you to watch very carefully what happens along this facial crest. So when we stop right here, we can see that there's a sequestra laying right there. And then as we follow this horse up farther, you can see these lines running here, an enlargement along the maxillary bone as we head up towards the frontal region, and we can still follow a discrepancy in this region. And actually you can see it again here. And as we go even farther, we're still seeing it all the way up to we're actually coming back forward then and right across into the kind of toward the central midline of the horse's head here. So I built you a 3D here so that you could see what's going on, and notice this fracture line here. And it kind of meanders down here and then comes forward down to the facial crest. So as we now stop this again, and you gotta kind of play with these images and get familiar with what you're looking at, and play with the window leveling when you're making 3Ds, because this right here is where the horse moved during the CT. So that's kind of an artifact. So it's a very straight line across the horse's head. And you gotta have to kind of notice those and figure out when you're going through your slices to make sure that you're not calling motion artifact a fracture. But this one we can see only starts at midline and comes along the side, where it's not on this side. And if it was an artifact, it would be going all the way around the horse's head. So to just finish this out then, as we rotate and position this horse, we can see that nice sequestra laying right here. Also to note, in young horses, we have to remember that the bone over these tooth roots or apex of these teeth is very thin. So it's no wonder that they get in scuffles and skirmishes and cause trouble with their teeth, because there's basically very little protection for them when they're young. So this was an interesting case. We knew that there was some swelling in this region. It was proposed to be a tooth problem, but it really wasn't. It was a fracture. And when we questioned the owner, she had this horse in with somebody that it was kind of fighting with, and they were misbehaving together. And we kind of could go back to a time where she realized that there was trauma. She just didn't realize that it was this extensive.